Welcome to Presbyterian Plano Center for Diagnostics and Surgery. Your safety, care, and comfort are our top priorities. Our facility, opened in 2004, is a licensed hospital where more than 400 physicians on the medical staff perform surgical and imaging procedures. The hospital is accredited by the Joint Commission, an independent, not-for-profit organization that accredits and certifies healthcare organizations and programs in the U.S. Our goal is to provide the specialty care you need with a personal touch.
I'm Larry Robertson, Administrator at Presbyterian Plano Center for Diagnostic and Surgery. Thank you for choosing our hospital for your healthcare needs. Our entire team of dedicated professionals is here to provide a positive and safe experience for you.
Presbyterian Plano Center for Diagnostics and Surgery is located on Parker Road, just west of the North Dallas Tollway in Plano. Convenient parking is located in front of the facility facing Parker Road. There are two types of surgery. Inpatient surgery means that you will be admitted and will remain in the hospital after your operation for 1, 2, or more days until you are ready to go home. Outpatient surgery means that you will go home the same day. Before any procedure, it is important to follow your physician's instructions carefully. If these instructions are not followed, it could result in the cancellation of your surgery. Do not eat or drink after midnight preceding surgery, unless instructed otherwise by your physician. Do not suck on hard candy or lozenges or chew gum. Tell us if you have any food or medicine allergies. If you take daily medications, consult with both your internist and surgeon regarding whether you should take them on the day of surgery, and if so, at what time. Bring any medication you may be taking with you in its prescription bottle, even if it is over the counter. If you take antidepressants, anti-inflammatory medications such as aspirin, Aleve, ibuprofen or Motrin, or blood thinners, ask your physician if you should stop them for a period of time prior to surgery. If you develop a cough, cold, or fever, please call your surgeon. Do not smoke tobacco or drink alcohol 12 hours prior to and following surgery. Do not apply any makeup, cream, or aftershave lotion the day of surgery.
Good morning. My name is Ann Kibler, and I'm here for a procedure with Dr. Baker.
Okay.
Our admitting personnel will register you for your pre-admission testing as well as your surgery or procedure. Please be sure and bring your driver's license or government identification with you, as well as your health insurance card. All patients are required to wear a patient identification bracelet. Physicians, nurses, and other caregivers carefully check bracelets for your name and birth date, as well as charts before any treatment, procedure, tests, or administration of medication.
Patients play a vital role in making their healthcare safe. We urge you and your family to take part in their care.
Unless otherwise specified, please plan to be at the hospital at least 1 hour before your procedure. You will need to check in with our admission personnel to review any last-minute details concerning your registration. You will be given a copy of the Patient's Bill of Rights, which explains your rights as a patient according to Texas state law. If you have not received one, ask your physician's office or admitting personnel for a copy.
My name's Starla.
Nice to meet you.
I'm one of the nurses. Have you looked at your bracelet here?
Yes.
Okay.
Once your admission paperwork is completed, a nurse will take you to the preoperative area.
Let's take a look at your bracelet, make sure all that information is correct.
Okay.
Name, age, birthday, physician.
Yes.
Okay.
A nurse will review your medical information with you. Bring a list of all your medications, times taken, and dosages, as well as a list of allergies to medications, foods, or other substances. At Presbyterian Plano Center for Diagnostics and Surgery, a universal protocol is followed by all caregivers. This protocol requires all caregivers to ask patients to verify their identity, procedure and surgery, or procedure site. The nurse will assist you in marking the operative site to ensure an error is not made. We take patient safety seriously. All caregivers wash their hands routinely to prevent the spread of infection transmission. If you see a hospital caregiver not washing their hands before contact with you, please ask them to do so. This will help us keep you safe. Prior to surgery, the anesthesiologist will meet with you. Please discuss any past experiences you or family members had with anesthesia.
Hello, Ann.
Hi.
How are you doing?
I'm good. How are you?
Doing fine, thank you. Are you ready?
Yes.
Okay. We're going to do a right inguinal hernia today, right?
Yes.
Your surgeon leads the operating room team. Prior to the procedure, the surgeon will check the previously marked site of your procedure. When it is time for your surgery, a nurse from the operating room will come for you. A handoff communication is done between nurses at this time to ensure the surgery nurse has the correct patient and procedure prior to going to the operating room. In the operating room, other team members may include nurses, anesthesiologist, and a surgical assistant.
The medical team conducts a timeout to confirm the patient's identity, the correct procedure, and the correct procedure site.
It's time for our timeout. And this is Ann Kipler, and we're doing a right inguinal hernia repair.
That's correct.
During your surgery or procedure, our patient liaison will continually update your family members and friends. A complimentary coffee bar is located in the lobby for our guests, as well as free wireless internet service and plasma television sets.
After surgery, you will be taken to the recovery room, also known as the Post-Anesthesia Care Unit, or PACU.
When you are taken to recover in the PACU, another handoff communication will be done. At this time, the PACU nurse will verify your identity and receive a report on you from the anesthesiologist and the surgery nurse. You will be closely monitored until the anesthesia wears off and you wake up. Once you are sufficiently awake, you will either be discharged or you will be transferred to a room. If you are discharged, our staff will discuss discharge instructions with you as well as medicine reconciliations. Presbyterian Plano Center for Diagnostics and Surgery is committed to recognizing and treating your pain using medicines and treatments that will provide the best level of relief. Please tell your caregiver when you are having pain, and don't be afraid to ask for pain medicine.
If there's anything you don't understand about your care, please ask questions.
Patients staying overnight may have one guest spend the night in their room. Visiting hours are from 9 a.m. to 9 p.m. If you stay overnight, please be prepared to show your wrist ID bracelet every time a nurse enters your room. This procedure helps to keep you safe. Amenities at the hospital include a hotel-style room service menu prepared by a 5-star chef, as well as satellite television and free internet service. Before you leave the hospital, your physician will evaluate the kind of care you may need after discharge. A nurse will review discharge instructions with you, as well as the medications you will need. Please call your physician if you have fever, nausea, pain not relieved by pain medications, and inability to urinate. A hospital representative will call after your procedure to check on your recovery. Patients are not permitted to drive home after surgery. Please make prior arrangements for your transportation. In addition to our surgical services, we offer imaging, including CT, MRI, R&F, and ultrasound. Special procedure rooms for fluoroscopy, colonoscopy, bronchoscopy, and pain injections are also available. We follow the same patient safety protocols in these areas, including site marking and timeouts before a procedure begins, and handoff communications every time we pass the patient from one caregiver to another.
The entire team at Presbyterian Plano Center for Diagnostics and Surgery wants to partner with you to be sure you have a safe, quality experience. You can be an active participant with us. It's important for you to ask questions if you do not understand the steps and the processes we are taking to take care of you. Please practice good hand hygiene and insist that we do the same. Together, we can make sure you have a safe, positive experience. And thank you for choosing our hospital.
Contact the preoperative nursing staff at 972-403-2750 if you have questions prior to your visit. And visit our website for more information.